HIV positive mother can give birth to a HIV negative baby. Yes, it's not only possible, it is increasingly common thanks to modern medicine. How? Let's explore this together. Hello everyone and welcome back to the channel. I'm Abhishek, a specialist pharmacist in HIV and sexual health. Over the years, I've worked with numerous women with HIV and have seen the joy when they deliver healthy HIV negative babies. Today, I'm going to share how this incredible outcome is achieved, breaking down the myths and fears surrounding HIV and pregnancy. First, let's understand how HIV can affect pregnancy. HIV is the virus which, if left untreated, can advance to AIDS. HIV can be transmitted from a HIV-positive mother to her child during pregnancy, childbirth, or breastfeeding. However, with the right treatment and care, the risk can be dramatically reduced. Let's find out how. Step 1. Early testing and diagnosis. Knowing your status as soon as possible can greatly improve outcomes for both mother and baby. That's why many countries use an opt-out approach for HIV testing during pregnancy. This means the HIV test is included as part of the standard prenatal checks. However, women can choose not to take it if they prefer. This method has been very successful in increasing the number of pregnant women who get tested for HIV. For example, in the United States, health guidelines recommend that all pregnant women get tested for HIV early in their pregnancy and again in the later stages if they are at high risk. This approach helps more women know their HIV status early and start treatment if needed, greatly reducing the risk of passing the virus to their babies. Step 2. Antiretroviral therapy or ART. Once diagnosed, the next step is initiating ART. Without treatment, there is 1 in 4 chance that your baby could get HIV. However, with the right treatment, this risk drops dramatically to less than 1%. Starting ART early in pregnancy is essential. ART works by lowering the amount of virus in your body to undetectable levels. This doesn't just keep you healthier, it also significantly reduces the chance of the virus being passed to your baby during pregnancy and delivery. Keeping the viral load undetectable is an important step in how we ensure the safety of both mother and child. Step 3. Regular monitoring. Throughout pregnancy, HIV-positive mothers undergo regular checkups to monitor their health and adjust treatments as necessary. At each visit, a dedicated team of healthcare professionals is involved in the care. This team usually includes specialist HIV nurses, HIV doctors, obstetricians, social workers, and specialist pharmacists who specialize in HIV, pregnancy, and childbirth. They all work together to provide comprehensive care. These checkups are not just about watching the mother's health, also ensuring that the treatment is adjusted as needed to protect both mother and the baby. Step 4. Safe delivery practices. Choosing the right method of delivery also plays a key role. While many HIV-positive women can have a vaginal birth, some situations, for example, if mother's HIV viral load is not fully suppressed, we may require a planned cesarean section to reduce the risk of transmission. Step 5. Postnatal care and feeding. After birth, it's crucial to keep both mother and baby safe from HIV. Babies born to HIV-positive mothers receive a special kind of medication called post-exposure prophylaxis or PEP. The doses are weight-based, and these meds help prevent the virus from taking hold if exposure does occur during birth. Alongside medication, choosing the right feeding option is also key. For many HIV-positive mothers, using formula milk is recommended to avoid the risk of passing HIV through breast milk. Healthcare providers help mothers understand how to safely prepare formula feed and give PEP medication to their baby. This guidance is part of the ongoing support to ensure the newborn stays healthy. With these precautions, babies can have a healthy start, even if their mother is HIV positive. By following these steps, I have witnessed firsthand how empowered and informed mothers overcome the challenges of HIV to deliver healthy HIV negative babies. Their stories are not just inspiring, they are a testament to the power of medical science and human resilience. So, if you're watching this and you're an expectant mother with HIV, remember, with the right medical care and support, you can have a healthy HIV-negative baby. This isn't just a possibility, it's a reality for many women every day. If this video has given you hope or valuable information, consider reaching out to a healthcare provider to discuss your own path and what steps you can take. And if you believe this message can inspire or help others, I encourage you to share it. Let's spread the word that with proper care, mothers with HIV can have healthy babies. For more resources and stories of hope, please connect with our community by subscribing to our channel and following us on our social platforms. Until next time, take care of yourself and stay safe, folks.